Our next presenter is Fiona Bian. She is a grade 12 International Baccalaureate student at Branksome Hall School in Toronto, Canada. She is a student volunteer at the Center for New Immigrant Wellbeing, which is a nonprofit organization that promotes immigrants' well-being through research, knowledge dissemination, and mental health support, particularly for immigrants from China. Her talk today is entitled Assessing Barriers Preventing Chinese Canadian Immigrants from Reporting Hate Crimes and Discrimination During the COVID-19 Pandemic. Welcome.
Good morning, everyone, and thank you for stopping by to our session. My name is Fiona Bian, and I am a high school senior at Branksome Hall School in Toronto, Canada, and a student volunteer at CNIW, the Center for New Immigrant Wellbeing, also in Toronto, Canada. I myself am Chinese Canadian, and I use the pronouns she, her, hers. I will be presenting a case study conducted by CNIW, where the main focus will be assessing the barriers preventing Chinese Canadian immigrants from reporting hate crimes and discrimination during the COVID-19 pandemic. I have no financial relationships to disclose. But before I start the land acknowledgement, we wish to acknowledge the land on which the Center for New Immigrant Wellbeing operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, the land on which CNIW operates is still a home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on that land. Here's an outline of the main points I'll be going over during the presentation. As a multicultural country, Canada has one of the highest rates of immigration of any country in the world. In 2021, almost 22% of the Canadian population was made up of immigrants, half of which were of Asian descent, and about 5% were specifically Chinese immigrants. As a visible minority group, these individuals are susceptible to racial discrimination. Anti-Asian racism includes not only the ongoing discrimination and injustices that Asians face, but also the historical marginalizations that these groups have experienced. Racism against Chinese immigrants in Canada can be traced back to the 19th century, when the Canadian Pacific Railway was being constructed and cheap labor was needed. Chinese workers were exploited and discriminated against through extremely low wages compared to their white counterparts, lack of safety equipment resulting in many avoidable deaths, and the Chinese head tax, which acted as a way to restrict Chinese workers from bringing their families over to Canada. Since then, negative stereotypes and other forms of racial discrimination continued to target Chinese immigrants in Canada, and now with an increased reliance on the internet, racism has spread to online hate and racist portrayals in media, leading to more derogatory thoughts. Recently, discrimination against marginalized groups such as immigrants, Indigenous people, and other visible minorities has increased. The outbreak of the COVID-19 pandemic from Wuhan, China in 2019 has only exacerbated pre-existing biases against Chinese Canadian immigrants, leading to an influx of discrimination nationwide. Fear of the virus led to some people taking their anger out on Chinese immigrants, and as such, various violent, verbal, and physical hate crimes targeting Chinese individuals have occurred since the pandemic started. These acts of biased discrimination instill fear in Chinese victims, discouraging them from taking any action against it. This issue urgently demands an investigation that will help mitigate the long-lasting effects of discrimination. The current study aims to assess the barriers that prevent Chinese Canadian immigrants from reporting hate crimes to relevant agencies. This study will answer the main research questions seen on the slide, and this will help suggest possible solutions for victims to receive not only counseling support, but also ways to report these hate crimes. An anonymous survey was conducted by CNIW and various other university partners from April 11th to 30th, 2021. The The target group of the survey were Chinese Canadian immigrants who had come primarily from mainland China and live in the Greater Toronto area. Other inclusion criteria included being age 16 or older and speaking either Mandarin or English. The questionnaire itself asked for a variety of information regarding 4 main categories. The first was the personal demographic information of the participant, which included age, gender, education level, marital status, employment status, length of stay in Canada, current living arrangements, religion, and health status. The next is discrimination experiences before and during the COVID-19 outbreak. This focuses on the types of discrimination experienced and the location at which they occurred. The third is their perspectives and psychological well-being after experiencing these acts of discrimination. And lastly, their reactions to this event and the constraints that they faced in responding appropriately. This survey was delivered in both simplified and traditional Chinese and was distributed to participants through WeChat groups and email links. The survey itself operated on an online survey program called Strix. Before starting the survey, participants were informed that their information would be anonymous and used solely for research purposes. Interested participants could refuse any questions and stop the questionnaire at any time. No compensation was provided. Bivariate and multivariate logistic regression analyses were used as necessary, and this study was approved by the Interdisciplinary Committee on Ethics in Human Research at Memorial University. Before we analyze the specifics in regard to discrimination victims, this slide has an image with an overall summary of the participants' socio-demographic factors. Of the 739 participants, only 588 were eligible. Of the included results, 54.4% were female, 21.5% were under the age of 45, and 87.2% had lived in Canada for at least 10 years or more. A large majority of the participants were born in mainland China and currently live in Ontario, with 93% and 87.3% respectively. On this slide, there is a data table representing the specific socio-demographic factors of the victims. More than half of the participants, 53.5% averaged across all genders, reported experiencing some form of racism since coming to Canada. There were no noticeable differences in gender, with 53.1% of males and 54% of females reporting discrimination. However, there were other noticeable differences between groups of other factors. This included age, level of education, and the length of stay in Canada. In age groups, the groups younger than 45, 45 to 54, and 55 plus had the following percentages reporting discrimination: 57.3%, 55.7%, and 47.8%. It was found that younger individuals and adults tended to experience discrimination more than older adults. As for the level of education, those with a university degree or higher had 55.8% reporting discrimination in comparison to those without a university degree, with only 38%. And lastly, for the length of stay in Canada, only 30.9% of participants who had lived in Canada for less than 5 years reported discrimination, compared to the 56.7% of those living for more than 10 years. It was found that individuals who had lived in Canada for more than 10 years, had higher education, and had better English language skills were more likely to report experiencing discrimination. There were no significant differences in the other demographic factors, such as religion, employment status, location and type of residence, and marital status. On the slide, there are 2 figures. The first is a generated graph representing the opinions of the participants to the following statement: incidences of discrimination against Asian immigrants has significantly increased since the outbreak of COVID-19. A large majority, with 75.82% of the participants, agreed or strongly agreed. Over half, 52%, of the participants found that it was likely or very likely that their families will experience some form of discrimination in the next 6 months. findings indicated that out of the 313 participants who had reported some form of discrimination, 53% had experienced specifically language discrimination at least once since coming to Canada. This data is represented in the graph to the left of the slide. The most common place to experience language racism were the following public places: restaurants, shops, parks, public transportation, etc., representing 44% of language discrimination victims. The next two most common venues were cyber platforms and workspaces. This is all represented in the data table to the right. The figure on the slide shows the answer of participants to the measures taken in response to discrimination. It was seen that out of those who had experienced some sort of language discrimination, 42% took no action, 20% left the scene, 23% shared the incident with family and friends, 24% argued back, and only 6.76% reported to the relevant agencies. And in this case, the relevant agencies includes not only counseling services, but also reporting services. A large majority of victims either took no action or passive action, and passive action refers to any response where no action was taken to combat the discrimination, and in this case includes leaving the scene and sharing the incident. The identified barriers seen on the slide of those who took no action or passive action included a lack of knowledge on how to report or how to receive counseling services with 31.57%, and others included avoiding further troubles, language barriers, and others. Despite the high incidence of anti-Chinese discrimination, most victims have gone unnoticed. Research work examining the severity of discrimination and its associated factors have also been scarce. This study was conducted to evaluate the prevalence of anti-Asian discrimination in Canada, filling a knowledge gap and providing evidence that is directly related to target intervention. It was found that a large majority of the participants had experienced some form of discrimination, most of which did not take any active action. Additionally, the noticeable factors that resulted in experiencing more discrimination were identified. The most significant key barrier that was identified is a lack of knowledge, which could prompt more research and programs in response. These results call for action to improve the current situation and mitigate the effects of discrimination. It is also important to discuss the limitations of this study. The first limitation is that being an online survey, the study sample may not represent the entire Chinese immigrant population in Canada. It would be too much of a generalization to assume that our small sample size represents all Chinese immigrants, mostly from mainland China. Another limitation is that discrimination can also be interpreted in a number of different ways. Our study aimed to focus on interpersonal racial discrimination. However, systematic discrimination may still occur. Since it is more deeply rooted, the consequences are also more severe. Further research conducted on systematic discrimination is necessary in the future. These results urge for immediate action to prevent anti-Chinese discrimination from occurring and support victims through legislation, and therefore a few possible suggestions have been made. The first is more research on Chinese immigrants in Canada should be conducted to understand the issue in more depth. This includes expanding to different populations, geographic regions, and time periods to include a much larger sample size. The second is increasing public awareness both in the media and online on the many historical and current injustices that Chinese Canadians face. This will promote not only cultural diversity, but also raise awareness on discrimination, benefiting both the Chinese Canadian population and society in general. The last is to improve and provide mental health support services for victims of discrimination. The issue of racism should be prevented, but in the case that there are still incidences, victims should have easy access to counseling services to better cope with these events. Here are the acknowledgements for the study. I wish to acknowledge all organizations, media, and individual efforts and contributions to data collection. And special thanks to all survey participants for sharing their experiences and opinions. And here are the references that I use. Thank you for listening.